So, Dr. Chung, thank you so much for joining us tonight. I'm joined with Hank as my co-host, and we're just so delighted and honored to have you as one of the giants in plastic surgery and a role model for so many in terms of your leadership, how you managed to be the editor in chief of Grabb and Smith PRS Journal and do everything else so well. So we're hoping to learn from you a little bit tonight.
Yeah, you're very kind. It's a pleasure. Without all of you helping me, there's no chance I'm going to get anything done.
And it's funny, when I told Maddie and Aaron that I was doing this podcast with you, they were like, "That's great, you're doing the podcast. You just have to make sure that it doesn't get better than the PRS Journal podcast."
How can it not be?
Exactly. So one of the things that Hank and I are interested in when we talk to people like you, and as we were saying earlier, some of the things that we don't talk about in conferences is a little bit about your upbringing and what kind of molded you as a child into potentially who you are today. Like, did you always love how to read and write? Were you interested in sports? But if you could talk a little bit about your childhood and what kind of molded you into who you are today.
Absolutely. I was born in Taiwan, and we moved to Singapore, where I spent most of my youth before coming to the U.S. And as a child, I am very interested in Chinese literature. So as soon as I can remember, I've been reading classics in classics of Chinese literature because my mother's a school teacher, and she would take me to school where she was teaching when I was probably 4 or 5 years old in her classes. So I sat in classes all day. And so I guess by osmosis, I was able to absorb a lot of knowledge as a very young person. And sports has been really important. I like all kinds of ball sports. If you put a ball in front of me, basketball, volleyball, anything that looks like a ball, even golf ball, for some reason, I can hit the ball. And so I feel that just being able to be an athlete in some way teach me about team playing, and at the same time, the principle of winning fairly and losing with grace.
So, where does the idea of medicine or potentially becoming a surgeon come into? Was there anyone in your life that was a doctor, or did you kind of stumble upon it along the way?
As with any traditional Asian family, the command by one's parent is really important. My grandfather was a family practitioner in Malaysia after World War II, and my grandmother is a really forceful person, and she has many children, and she pretty much tell all the children that our family need to have doctors. And so because she has 13 kids, and from there are a lot of grandchildren, and I think that we represent the Lin family, her family, Lin family, LIN, represent probably 40 to 50 physicians around the world, particularly in the U.S., in every single specialty. And I think that that mandate and also the culture of serving and also the honor of being a physician has been stand very clearly to us that the only job you can possibly have is being a physician, and the surgeon has.
Yeah, that sounds a little bit like my family and my dad. My dad was like, you can be a lawyer or a physician. Those are your two options.
There you go.
So what attracted you to surgery and plastic surgery specifically?
Given I'm always quite good with my hands, and I went to Texas for general surgery, and during the general surgery time, I was actually going to go into cardiac surgery just because our program produced a lot of cardiac surgeons. However, I think cardiac surgeons present a unique challenge given that it deals with life and death regularly. However, the number of operations that a cardiac surgeon would do is a bit limited. And I feel that the ability to leverage the creative mind can only be satisfied in plastic surgery. Therefore, plastic surgery is the ideal choice just because it's such a fluid specialty. And we have no territorial or anatomic boundaries, and that suited me quite well.
Yeah, and then in terms of then you did your training at Michigan and Curtis as well. Who do you think were your main mentors during that period? That is such like I remember my training. Hank is going through his intern year, and having good mentorship during your training is so important and influential. Who do you think do you recall as powerful mentors during that time for you?
Yeah, that question has been posed to me before, and it's really difficult for me to answer because I cannot think of a singular person because our career is shaped by many facets and many different kinds of people. I would say that there's two groups of people that has been influential in my career. One group is my patients, because I study outcomes, and every one of my patients who I take care of, I want to have a relationship with them. Each one of them will have a pre-op picture, intra-op picture, post-op picture. I've been collecting materials for over 30 years, and in any instance, the patient's picture can come up. I can study. When I did an operation, a complex operation well, I want to do it again. I want to be proud of what I've done. I want to be happy. And when I do an operation that patients feel is outstanding, when I look at it, I see the imperfections, and I want to do better. So every 2 or 3 weeks, I review all my pictures with my team, and I'm always able to examine my outcomes. And I feel that my patients is certainly my biggest mentors because they taught me how to reflect and how to do better. And I was a Robert Wood Johnson Scholar, which teaches me about health policy, outcomes research, statistics, and so forth. And during that period, I was able to interact with brilliant people in other specialties, internal medicine, in pediatrics, in health policy. And I think that all my teachers during my training has given me a different perspective. I know how to talk to people from a school of public health. I know how to talk to people from the health policy standpoint. And I know how to talk to other specialties because other specialties influence plastic surgery. And I feel that many of the other specialties has instilled a lot of guidance to plastic surgery as well.
Yeah, I love that answer too, that even when you have an outstanding outcome, you're still seeing the imperfections, kind of like a Michelangelo or an artist who's like trying to really perfect their field. So I would imagine that's kind of hard when it comes to writing. It probably makes you a great editor and a great writer, but does that mean how do you know when it's done? Because I feel like you keep wanting to keep making edits and changing it and stuff like that.
Being an editor for a prestigious journal such as PRS is a sacred duty, and the sacred duty demands me to preserve the identity of the authors. It is not my role to do the research that I want to do. It is my role to make sure that the authors get sufficient feedback from the editorial board, from all of you, so that they can grow, they can do so-called better. And the peer review process is absolutely essential. Is that the voice of the authors must be preserved in PRS. The writing style must be preserved for each individual author. And that's really the spirit of plastic surgery. We are plastic, and the authors has to be plastic. We cannot have a one-dimensional writing style and also a template that all the papers come in. So for me, I'm absolutely thrilled that we have maintained that mission of the identity of the authors, and at the same time to help them be even more creative and understand how to grow as a scientist, surgeon scientist in particular.
That's a great segue into what I'm interested in next is how you became the editor-in-chief of PRS. And when the search began for the seventh editor-in-chief, how did you get involved in that process? And then when you actually named the editor-in-chief, what's kind of the first thing that ran through your mind as to, this is going to be my goal, or I'm so excited because this is what I want to do?
Preparation for a potential career is absolutely important. One cannot just jump into, let's say, an editor-in-chief without 30 years of preparation. It's a really famous Chinese history story, in which this person said, I have sharpened my knife for 30 years, and now I'm ready to use it. He has been hiding obscurity and has been sharpening his knife, figuratively, for 30 years for the opportunity to take over a country that he thinks needs a different leader. And for me, since Dr. Gowen, I've been working with PRS for a long, long time. It's not because I aspire to be the editor of this journal and I've never thought that I could be eligible. However, preparation is absolutely important because I know every aspect of the journal, including production, including peer review, because I've done it so much. And when the call comes, that I will have something to give to the specialty.
Yeah, that's such a valuable statement for so many people, because a lot of people think that, you're doing that sharpening of the knives for so many years and it's going to waste. But when the time comes to use everything that you're doing, it's so impactful, all that time that you've had preparing. And so when you first heard, okay, I'm going to be the editor in chief, was there a goal that came to mind, like, a top priority that came to mind for you?
People would think that, as soon as you take over this position, one would be a lot of emotions that go by. I really don't have a lot of emotions, actually. I feel grateful that I was picked. And however, I am absolutely confident that we'll do a magnificent job. Why is that? Because I would inherit a wonderful editorial team. I would inherit some of the best in my specialty because they're just like me, who put in all the effort into helping PRS. And we have staff who have been there for a long time, and the staff is absolutely ingrained in the culture of excellence for PRS. We have support by the ASPS PSF leadership, and in fact, we have support by all the readers. So when I come in, I just feel a sense of excitement, just because we will do very well with all the energy behind this 77-year-old journal. And for me, I'm absolutely thrilled to have this opportunity. And since the first day, we've been moving intensely with all kinds of activities to make EPRS an efficient organ of our specialty.
I think it's so incredible that our journal has a 5+ impact factor. And I feel like it's been the subject of conversation amongst medical students, residents, and the readership it's just so wonderful to hear how many people are turning to the journal. So that always seems to get me excited. And what do you think is, like, do you have any advice on what it takes to get a paper accepted? If you had to, like, tell people, is there any advice that you'd have for somebody writing maybe perhaps their first paper or just in general?
Absolutely. With the information age, everything is within our disposal. We should be able to find anything we need. Before, when one was not able to find certain materials, it's just because it's difficult to sift through books and whatever manuscripts that are not on electronic format. But nowadays, with a click, one can find materials. And I've written a lot of guides to help people to be competitive and also be successful. And some of the papers are interesting papers, such as the "So what? Who cares?" question. I think that's the most important, one of the most important message for an author is to have a project and ask their colleagues, maybe even their family members, and said, I have this topic, and these are 3 of my conclusions. And if their colleagues said, wow, I did not know that, you have something. You have answered the "So what? Who cares?" question. On the other hand, if they go, wait a second, why do you even need to do this project? I mean, if the answer is so apparent, well, you have a problem. And I think that so some of those papers I've written about "So what? Who cares?" and also in particular study design is absolutely essential. How many times have we seen papers not able to pass through peer review because there's no control group? We have no idea whether the effect you're seeing is because of just patients, self-selection, or once you subject to a control group, that there's really no difference between the new technique and the old technique. And I think that knowing study design is really, really important to separate one from the rest.
Yeah. Are there any other, like, just common mistakes or pitfalls that you see over and over again?
Well, common pitfalls is being compulsive. I mean, The first impression is important. When you send a paper in, the paper has track changes. That is not a good thing.
Yes.
When the abstract look exactly like the introduction, that's not a good thing. When the references are AI driven and we cannot verify the references, that's not a good thing. And in fact, we wrote the editorial, I think maybe about 6 to 9 months ago, about common pitfalls in publishing PRS, in which I listed all those things. And when I go to a major meeting and people ask me that question, I ask them, did you read the editorial I wrote about the common pitfalls? Yes, you already know what the answer is. No one raised their hands. And that kind of tells me that, come on, guys, I'm telling you in black and white what it takes. Read them so you can get better. And I think that people need to read more. If they read, and all the answers are in the palm.
Absolutely. You mentioned this briefly, but what's your take on artificial intelligence and paper writing? Because it's one of those things where I think we all have to recognize that artificial intelligence is here to stay, and it's super, super impressive. The potential is tremendous, and you can use it in almost any aspect of your work these days. So I have a feeling at some point we have to embrace it to a certain extent. But what's your take on artificial intelligence and paper writing and paper reviewing, et cetera?
Artificial intelligence bridged the gap amongst different countries. And what does that mean? Because other countries, English may not be the primary language, the primary medium. And for the expression, syntax may be a problem. And I think that for those countries that want to have the paper in PRS, I think that having AI to help them with syntax is acceptable as long as they disclose it in their submission. Because we need to be open. However, the temptation of over-relying on AI is a problem in the sense that, well, if you use AI to do it just once, you're going to do it again, and the cascading effect of using the AI may result in AI writing one's paper. Well, if that's the case, then how is one going to grow intellectually as an author? How is one going to be able to craft his or own sentence in the spirit of their personality? How can one continue to grow as a scientist, as an author, if that temptation continues to use AI exclusive of a personal development? And I feel so. My people, my students, I tell them you cannot use AI because I want to see them grow as an author, and I really think that the over-reliance on the AI will stunt one's personal growth.
Yeah, I totally agree. What are your do you have any personal clinical interests or research interests currently that you've been working on?
The vision statement for Enquire, which is Michigan Center for Health Outcomes Research and Innovation, the 30 plus group that I lead currently, has a mission statement indicates that we want to speak for those without a voice and want to advocate those without means. And everything that we do in our lab has to have a health policy inclination, have to be able to be applicable to the general public, particularly those who are disadvantaged. And so anything that has such a focus is part of our research interest. And in terms of when I take care of patients, when I write papers and so forth, the first thing our team need to think about is that, how can I make someone better? I mean, how can I care for those who are poor and who may not have the means? And I think that's probably the most important goals that we have in my clinical arena and also my research arena as well.
And speaking of research, as a NIH R01 funded researcher, what are some pearls to the grant writing process that you'd have to say? You spoke a little bit to, what you think your pros to success in writing and publications, but what's that one step further is the grant writing process. Do you have any pros to success to those who are just starting that process?
I was fortunate that American people have deemed my team's contribution worthy of funding for over 25 years. We have continuous funding for over 21 years, and we have run some big time trials, even a 25 center trials. And in reflecting about an NIH funded investigator, one need to have patience, one need to have tenacity, because we don't get to where we are by having a lot of failures. But when one is striving to be an NIH investigator, failures are everywhere. Just because the project is so meticulously crafted and articulate does not mean that you can go through suitable peer review process. And complaining is not going to help. I think that we need to be humble and be able to take those critiques and being able to come back again and again. Many of my grants that have taken 2 or 3 years to craft were not successful. However, we continue to refine itself and have different avenues of creativity. And one of the trials, the RIS trial, which concluded 2 or 3 years ago, took 10 years. It took 3 years to get pilot data, to develop a story, and then after that, once the story is developed, to have the grant funded after 2 cycles, and then took about 7 years to get the data. We did not write a single paper for 7 years, and this is a collaborative group of 100 investigators. 100 investigators, 100 hand surgeons, 100 surgeons and investigators are hanging together for 7 years with not a single publication. And after that, we have, a series of papers in JAMA and everything else. And that really attests to the creative, also the bonding spirit of the whole team, because they need to know that this trial would never be done again in its 200-year history of treating distal fracture. And one has to know that if they consider this as Dr. Chung trial, it's over. They're not interested. No one's interested to build Dr. Chung's CV, but we're interested to solve a problem that has not been solved in 200 years. And so when you ask me that question, I think the most important message is that equip yourself to be an NIH investigator. Because I was a Robert Johnson scholar, there are not a lot of surgeons who are Robert Johnson scholars. They know that I have the credential and credibility to run the trial. I think that's important. One needs to have a confidence of the NIH investigator to be able to do something big. The second thing is one has to be patient. And number 3 is that, one must have very thick skin because one would fail regularly. And in the profession, in our lives, we rarely fail.
Yeah. To that point, I sent something to Hank the other night that Jeff Bezos said. He said that you can be grinding for 4 years with no results, and in the 5th year become the biggest thing on the planet. The power of not giving up is real. And it just reminds me, I remember you sharing that story at an editorial board meeting of how it took 10 years for that trial. But the thick skin and the perseverance are so big.
It comes back to sharpening the knife from the very beginning. You just keep working in the dark until it's your time to arrive.
Yeah, absolutely.
So everything that we're talking about, how do you find time? You're the chief of hand surgery at Michigan. How do you find time to operate? Do you have operative days of the week, admin time? What does your typical week look like?
No, thank you. I have elective schedule twice a week, and I take 4, 5, sometimes 6 days of call a month. And we are major referral centers, which means that complex things come to me. I do, very interestingly, Dr. Fu Chang Wei told me once when I visited with him, he goes, "Kevin, do you know who I am?" I said, "You are Dr. Wei." No. I'm a 5-star chef. And he goes, "Okay." Was waiting for him to tell me something. He see that I have this incredulous look. And he said, "I don't do omelets." I go, "Okay. Dr. Wei, tell me more." "Well, I'm a 5-star chef. I don't do omelets. I do big things, like big meals." And so I go, "Great, Dr. Wei, can I borrow this?" Like, "Sure." So there's a thing in my clinic Instead, the nurse was going to say, Dr. Chung, I'm so sorry. We're seeing an omelet today. We just sit down, right? An omelet for hand surgeons is a carpal tunnel. I enjoy taking care of patients with carpal tunnel, but I do manual hands. I do complex rheumatoid. We just put a toe in this poor kid who has lost 3 digits, including a thumb, in a normal injury.
Wow.
We took a toe and used AV loop and whatever to put it in the 7-year-old, 6-year-old. And so I do big operations. And every time I do this, I remind me of what Dr. Wade told me. He's a 5-star chef. And so I need to prepare. I need to prepare for these complex operations. Fortunately, I've done it for a long, long time, and I'm technically pretty decent. So those complex operations is a good avenue for me to teach my team about how to think and have plan A, plan B, and plan C. I wrote a paper about simulation. When you do a complex operation, you've got to be able to simulate as an athlete, musician, and so forth. You got to be able to play it in your head before the operation so you know where all the pieces are going, so that when you do the operation, someone watching you would say, Sai would look at the operation kind of say, this is easy. Well, the reason it's easy because we make it look easy. And it's really not easy. So when we want the fluidity of the operation because we have run it and the simulation is absolutely essential.
Yeah. And I'm going to bring up Tom Brady, not only because he went to Michigan, but also because Saeed loves talking about Tom Brady. And I think I was listening to something recently where he said the same thing about the Super Bowl that just happened, that when quarterbacks make it look easy, it's because they've been doing all this preparation on the other team's defense for months and they know their different schemes. And he said his superpower was recognizing what the defense was doing. So it wasn't like he was doing anything special other than he just been studying. So he was like, oh, they're going to blitz from here, or this path is going to be open. And he could simulate it in his head beforehand, kind of like what you're saying. And then it all just comes to fruition in real time, which is really cool.
Someone actually measured Tom Brady's release time towards the end of his career. His release time is, we're talking about 0.5 seconds, 1 second, right? It's a big deal because he's able to anticipate where the pressure is coming, and he doesn't get sacked often. If he gets sacked, he's finished. He doesn't get sacked often just because he can release the ball so quickly. And I think that's right, Hank, is my simulation.
Yeah, because he must have been anticipating it, or else there's no way for it to be that quick. It has to be like an intuition almost, because there's no way. So you kind of alluded to this as well, just with being chief of hand surgery, asking what your operative schedule looks like, taking call. We would be remiss if we didn't mention that you were also editor-in-chief of Grabb and Smith. So you're so busy with all these things, editor-in-chief of PRS. How do you find time for everything else in life? And what is your do you exercise, other hobbies that you're currently interested in? Can you talk a little bit about that?
Yeah, and do you sleep at all?
Yeah, no, those are packed questions. I align myself with some of the best people, and as someone who is really busy, just like you guys are, to be able to identify talent is absolutely important. And talent is not the only ingredient that I want to see my people. I want to see passion. I want to see commitment. I want to see self-sacrifice and altruistic things. When I identify those people and the team that I lead, a 30-member team, they all have those qualities. Some of them may be undergraduate students, some of them may be medical students, some of them are more senior, but they all have the same kind of ingredient to be successful, which means that I give them a lot of so-called latitude to do things. There's no such thing as there's no hierarchy in our team, just because anyone can lead a project. In fact, the Grabb and Smith project was led by one of my undergraduate students who spent 2 years in my lab. And because she's so organized that she's able to coordinate many activities. And I don't know whether Saeed, when you contribute in my chapters, get a communication with some of my students, but those are my students. So Hank, it's not a one-person effort. When you mentioned Grabb and Smith, when you mentioned all the other things, it's a combination of everyone helping and simply someone on the sideline putting the pieces together. While they're weaving some of the pieces together, and everyone are able to contribute and become successful. And so that's satisfying to me. And so he asked me, do I sleep? I sleep in aliquots. What does that mean? That
aliquots, little drops.
Yeah, little drops. I respond. If you send me email at 3 a.m. in the morning, people in Asian countries, because we're 12-hour difference, feel that I never sleep because when they email me at 2 o'clock in the morning, I respond in 10, 15 minutes. And when someone email me from Europe, 7, 8 hours, I respond within minutes. And of course, during the day, you respond. Because I sleep in aliquots. I don't know if you remember the Seinfeld episode in which Kramer adopts this aliquot theory. He sleeps 15 minutes and wake up and start doing stuff.
Yeah,
I love that episode.
Yeah, it's funny because there's 3 people that come to mind in terms of responding to emails right away. You, Rod Warwick, and Scott Levin immediately. And I always tell people that if I email any of the 3 of you and I don't hear a response within a day, I feel like I should call 911 or put like a missing notification out on the web or something.
Yeah, I mean, one of my students sent me a paper. I did not respond in a few hours. I mean, not a few hours, half a day. They would say, Dr. Chung, do you get my paper? sorry. I was busy. I was doing a whole transfer. I did not check my email. So people do chase me when they get a response.
I want to say, this is more of a comment, but I want to say something about how special you are to the audience, kind of off script. But I remember being a brand new attending, having just finished my MSK fellowship, and I was involved a little bit peripherally with PRS as a resident ambassador, but it was almost within the first month of starting off as an attending, I get an email from Dr. Chung. It's an invitation to contribute to Grabb and Smith. And part of the email says, Sayed Azoury, this is in hopes of promoting younger people in the specialty. But not only did Dr. Chung invite me to contribute to Grabb and Smith, which is an incredible, incredible honor, he invited me to then invite a few of my colleagues to contribute to Grabb and Smith. And I share that story all the time about you, Dr. Chung, because I think it shows a lot about your emphasis on promoting the next generation, your hospitality, and we're all forever grateful for the opportunities like that.
Oh, that's a wonderful story. Keeping the script. There's really no need to be off script because this is exactly what I want to do, because I was given permission to be editor for hand clinics. And hand clinics is read over the world because it summarizes things. And when you look at the contributing editors for hand clinics, you see all these, I would say young. I mean, they're in the 40s, but specialties considered young, just because it's so important that we give people the exposure. I mean, some of these more senior people have the days. They don't need any more exposure. However, the younger people have so talented, so much enthusiasm. They'll be the next wave of contribution to our specialty. They need to be recognized. So I really appreciate Saeed remember that, because it's intentional. It's not as if I just pulled his name out of the hat. I've been observing him for a while. I go, this guy is going to be special. I got to get him before someone get him.
No,
I'm meeting with Hank. I'm going to get Hank before someone get him.
I think I know that you probably are not going to answer this question, but and I might mispronounce the name, but you've gotten a number of awards and recognitions, distinctions over your career. I believe it's called the Weiland Medal from the American Society for Surgery of the Hand, being the first recipient. Is there anything that makes you most proud and that you constantly think of or constantly remember that you'd like to share with us?
I have a lot of responsibilities to my kids. I call them kids, and then sometimes people ask me, "How many kids do you have?" Well, I mean, anyone in my lab, they're all younger than I am, so I call them kids. And so I only have one child, but I have a lot of kids in my lab, and many of them have won awards such as writing awards and being accepted to medical school and get accepted to a competitive residency and so forth. And anytime my kids, I was able to place them at good places, those are wonderful achievements, because our kids work really, really hard to achieve what they have achieved. And for me to play a little role in the career to get them what they want, and what they wish to contribute is wonderful, because each one of us is one person. We interact usually one-on-one, but our tentacles as educators reach very, very far. And when our so-called little kids go elsewhere and being able to influence even more people, now that's our life worth living. And I feel that's so important that we're all going to pass. Hopefully, we'll leave something better behind as we pass in our career. And I think that having this podcast is actually a really, really wonderful thing for me to do with you, Saeed and Hank, just because I'm leaving something behind, right? I'm sharing with you openly what I'm thinking and what my philosophy is, and hopefully someone can find that useful.
Yeah, no, absolutely. Just curious, is your one child doing medicine?
He doesn't like to take call, so he's not doing medicine.
Yeah, I don't blame him. Any regrets in your career? Life is maybe perhaps filled with bumps along the way, and sometimes you look back and say, maybe I should have done this differently, but there are moments that you learn from those to grow. But is there anything that comes to mind, like, if I could go back, maybe I would do this?
Yeah, we all have one life to live, and I regret I have not worked harder. I need to work harder. I got so much to teach and so many people to meet and so many people to interact and so many patients to take care of. I need to work harder. I just need to leave even more behind. And I know this is a bit facetious. However, I think I've worked really hard in my career just to make an impact. And regrets, looking back, I always feel that my career is shared by someone who knows what I can do. And any opportunities given to me, I'm going to do it the best of my abilities. And I don't think a lot about what I should have done and should have gone and so forth, because I always feel someone's guiding me. And when someone's guiding me, I will do my best, and I will make the world a bit better just because I was here.
Well, I hate to break it to you. I hate to be the one to break it to you, but I don't think you can work any harder. So I'm sorry. But Hank always laughs when I comment on this, and maybe I am becoming a Tom Brady fan. But Tom Brady in his Hall of Fame speech talked about perseverance and dedication and waking up at 6 a.m. in the morning to practice lift weights while all of his friends are sleeping until 9 and eating pancakes. And that it's not hard to be special. Really, you just need to persevere and be dedicated. And listening to you, it really just helps that really stick.
Yeah, thank you. Kobe Bryant is the same kind of person as well.
Yes.
Yeah,
and
exactly.
And he's a little bit cooler because he was a Philadelphia Eagles fan. So
nice.
Well, he went to Lower Merion.
And he went to Lower Merion, Philadelphia.
Yeah.
But so is there any, we're getting down to our last few questions, but life outside of medicine, reading, writing, etc. Is there anything that you like to do in your free time that you make time for, either on a weekend or a weekday night or etc.? Anything you like to do as a hobby?
Yeah, this will shock you, because of my limited time, I need to use my exercise time effectively, and I played tennis for many years, and I'm a pretty decent player, having won some awards. And then my wife feel that I need to push myself even harder physically. So every morning I go to the gym at 6 o'clock, and I join these exercise classes with people I have no idea who they are, but the teachers are all these really fit, monstrous, committed teachers, and they push us all to clear the limits. So I do that. And the one that you'll be surprised is that I picked up golf 3 years ago, because my son plays golf, and it's a good opportunity for me to chat with him when we are on the course for 4 hours. And so first year, people ask me what's my handicap. I never taken a single lesson. I watch YouTube videos, and people kind of say that, oh, I'm not good at golf. I tell them, let me tell you, the kind of people we are, the kind of competitive people we are, if you want to be good at something, you can be good at something. Because I watch YouTube videos, I watch some of the masters, including Ben Hogan and Tiger Woods and so forth, and how they play. and Jack Nicholson and so forth. And I learned the styles. And because of the ball, I can hit balls. First year, you lose 10 balls every 18 holes. Second year, less. And this year is the year that I clicked. I was able to hit the line drives. I was able to fade the ball. I was able to hit stingers. I was able to find the green most of the time. So which is quite remarkable. So now golf is fun. The first couple of years is totally no fun, but now golf is fun. So I enjoy doing that. Yeah, thanks for asking.
Yeah,
and it's by watching YouTube videos.
That's awesome.
Thank God for YouTube these days, honestly, for so much of fixing cars, golf, changing a light bulb. I wonder if your wife is anything like my wife, and when you're up late doing work, say, Saeed, can you just put your books away for one night?
Yeah, no, you're very right. I mean, at the end, she always remind me that at the end of the day, the only people that really cares about you is your family, right? So yeah. But
clearly, when Hank has somebody special in his life, and clearly you need that special person, the support, and we owe everything, if not most things, to them.
Agreed.
Yeah.
So true.
Hank, you want to hit the last question?
Yeah, we just have our last couple fun ones. What's your favorite surgical instrument and why?
Yeah, I'm really transparent, and some of the stuff I say, it's not it's kind of doesn't fit into the fantasy image of what I should be saying. because let me tell you, I don't know my instruments. I mean, when I put my hand out, someone give me something, I'm going to use it because I'm moving. So if I want to do micro, someone hand me a hemostat, I'm going to take hemostat and start sewing. Okay, I don't have time to look around for stuff. So it's really interesting that when I put my hand out, there'll be some instrument in my hand, and I'll be using it. And fortunately, my nurses know my hand gestures, and they will usually give me the right things. However, if it's not the ideal things, I would still use it. So I don't have a favorite instrument. I just use whatever they give me.
So your favorite instrument's whatever you need at that time. I like that.
Because I do a lot of volunteering things in other countries, in Africa and South America. Every year we go on I go overseas to take care of children with burns and deformities and hand problems, and they don't have anything. I mean, I've been using it. The other time was in, several months ago, I was in Vietnam. They gave me this hip tray when I was trying to put a screw in this guy's wrist, and the hip tray has instruments are this big and whatever. And you know what? I just remember, I put my hand out, they hand me something, I just put it in there.
That's how you know that's how you know you're a master, though, when you can pretty much use anything. And then our last question is, do you listen to music in the OR? And if so, what do you like to listen to while you're operating?
Yeah, I think music is soothing, and in terms of classical music is always wonderful because it's just amazing. And when you have a particular piece you like, the interpretation of that piece can be quite varied by different people. So my music interest is quite expansive. Anything that's music is enjoyable, except that I still have not gotten used to the contemporary creative use of foul languages in songs. I just cannot deal with that. So when I hear those things, I don't think they're part of my collection.
Well, Thank you so much. This was a ton of fun. Not only did I learn a lot, it was a lot of fun. And one of our upcoming guests is actually Professor Fu Chun Wei. So we'll see if he brings up the chef story.
That's awesome.
Yeah. Thank you so much.
Thank you. Thank you.
Thank you so much.
Yeah, appreciate it. Thank you so much.